Question 1. Risk assessment procedures indicate a correctional officer at a federal correctional institution in the United States observes an inmate receiving a package that appears unusually heavy and is sealed with excessive tape, raising concerns about potential contraband. What is the most appropriate course of action for the correctional officer? Option A. Discreetly place the package in a general holding area for later inspection, assuming it is likely legitimate and not wanting to cause a disturbance. Option B. Directly question the inmate about the contents of the package and attempt to open it to verify its contents, believing that immediate verification is the most efficient way to ensure security. Option C. Document the observation in detail, secure the package if possible without direct inmate interaction, and immediately report the findings and concerns to a supervising officer or the designated investigative unit for further assessment and action. Option D. Discuss the suspicious nature of the package with other inmates in the vicinity to gauge their reactions and gather informal intelligence. The correct answer is C. Document the observation in detail, secure the package if possible without direct inmate interaction, and immediately report the findings and concerns to a supervising officer or the designated investigative unit for further assessment and action. Explanation. This scenario presents a professional challenge because it requires a correctional officer to balance the immediate need for information with the fundamental rights and safety of inmates, as well as the integrity of the institution. The officer must navigate potential conflicts between departmental policy, inmate privacy, and the imperative to maintain order and security within the Federal Bureau of Prisons (BOP) system. Careful judgment is required to avoid actions that could compromise investigations, violate inmate rights, or lead to disciplinary action against the officer. The best approach involves prioritizing established procedures and seeking appropriate authorization before taking any action that could impact an inmate's communication or property. This includes documenting the observation thoroughly and reporting it to the appropriate supervisory personnel or investigative unit. This approach is correct because it adheres strictly to BOP policy regarding inmate communications and searches, which mandates that any search or seizure of inmate property or mail must be conducted under specific circumstances and with proper authorization. It upholds the principle of due process for inmates and ensures that any information gathered is obtained legally and ethically, thereby maintaining the integrity of any potential investigation. An incorrect approach would be to directly question the inmate about the contents of the package, or to attempt to open and inspect the package without proper authorization. This is professionally unacceptable because it bypasses established protocols for handling suspicious items and inmate communications. Such actions could be construed as a violation of inmate privacy rights, potentially leading to legal challenges against the BOP. Furthermore, it undermines the chain of command and the investigative process by acting unilaterally, which could compromise the collection of evidence or alert individuals involved in illicit activities. Another incorrect approach would be to ignore the suspicious package altogether. This is professionally unacceptable, as it represents a failure to uphold the officer's primary duty to maintain institutional security and prevent contraband from entering the facility. Ignoring a potentially suspicious item could have serious consequences, including the introduction of contraband that could endanger staff and inmates or facilitate criminal activity within the prison. A third incorrect approach would be to discuss the suspicious package with other inmates. This is professionally unacceptable as it violates inmate confidentiality and could create unnecessary tension or fear within the inmate population. It also risks compromising any potential investigation by prematurely revealing information or creating a perception of bias. Professionals should employ a decision-making framework that emphasizes adherence to policy, clear communication, and the chain of command. When faced with a suspicious situation, the first step is always to observe and document. Next, consult relevant BOP policies and procedures. If the situation warrants further action, report the observation and recommendation to a supervisor or the appropriate investigative unit. This ensures that actions are taken with authorization, in accordance with regulations, and with the collective knowledge and support of the institution's leadership. Question 2. Process analysis reveals that a Federal Bureau of Prisons correctional officer has recently discovered that an inmate under their supervision is a former acquaintance from outside the institution with whom they had a casual friendship. The officer has not had contact with this individual for several years prior to their incarceration. The officer is concerned about how this situation might impact their professional duties and the inmate's treatment. What is the most appropriate course of action for the correctional officer in this situation? Option A. Discuss the situation with a trusted colleague to gauge their opinion on how to proceed without formally reporting it. Option B. Discreetly offer the inmate minor assistance with non-critical institutional matters to maintain a positive relationship. Option C. Immediately report the prior acquaintance to their direct supervisor and request to be recused from any duties involving the inmate. Option D. Continue to supervise the inmate as usual, assuming the past acquaintance is not significant enough to warrant special attention. The correct answer is C. Immediately report the prior acquaintance to their direct supervisor and request to be recused from any duties involving the inmate. Explanation. This scenario is professionally challenging because it pits a correctional officer's duty to uphold institutional rules and safety against a personal relationship and the potential for perceived favoritism. The officer must navigate the complex ethical landscape of maintaining professional boundaries while acknowledging a personal connection, all within the strict confines of Federal Bureau of Prisons BOP regulations. The core challenge lies in ensuring that personal feelings do not compromise the integrity of the correctional environment or lead to unequal application of rules. The best professional approach involves strictly adhering to BOP policy regarding inmate interactions and reporting any potential conflicts of interest. This means immediately and formally reporting the personal relationship to a supervisor and recusing oneself from any duties that could involve the inmate. This approach is correct because it directly aligns with BOP Program Statement 5320. 10. Inmate discipline, which mandates impartial application of rules and prohibits staff from engaging in personal relationships with inmates. It also upholds the ethical principle of avoiding conflicts of interest and maintaining professional integrity, ensuring that the inmate receives fair treatment and that the officer's judgment remains unbiased. An incorrect approach would be to ignore the relationship and continue with normal duties, hoping it goes unnoticed. This is professionally unacceptable because it violates BOP policy by failing to report a significant personal connection that compromises objectivity. It creates a direct conflict of interest and opens the door to accusations of favoritism or preferential treatment, undermining the trust and fairness essential in a correctional setting. Another incorrect approach would be to subtly assist the inmate with minor infractions or to overlook rule violations due to the personal connection. This is ethically and regulatorily unsound, as it directly contravenes the BOP's mandate for uniform enforcement of rules for all inmates. Such actions constitute a breach of duty, potentially endangering the safety and security of the institution and its population, and can lead to severe disciplinary action for the officer. Finally, an incorrect approach would be to discuss the inmate's case or disciplinary matters with other staff members in a way that reveals the personal relationship without proper reporting channels. This is problematic as it could inadvertently spread gossip, compromise the inmate's privacy, and still fail to address the core conflict of interest in a formal and appropriate manner, potentially creating further complications. Professionals should employ a decision-making framework that prioritizes institutional safety, regulatory compliance, and ethical conduct. This involves recognizing potential conflicts of interest immediately, consulting relevant policies and procedures, reporting concerns to supervisors promptly, and acting with impartiality and integrity in all interactions. When a personal relationship with an inmate is identified, the immediate and only correct course of action is formal reporting and recusal from any involvement. Question 3. Strategic planning requires correctional officers in the Federal Bureau of Prisons in the United States to anticipate and respond to inmate behavior. If a correctional officer observes an inmate they know personally, outside of their official capacity, violating a minor institutional rule, what is the most appropriate course of action? Option A. Immediately document the infraction and report it to the shift supervisor according to BOP procedures. Option B. Confront the inmate directly and discuss the consequences of their actions without involving supervisors. Option C. Discreetly warn the inmate about their behavior and advise them to cease the activity without formal reporting. Option D. Ignore the infraction, considering the personal relationship and the minor nature of the violation. The correct answer is A. Immediately document the infraction and report it to the shift supervisor according to BOP procedures. Explanation. This scenario presents a professional challenge due to the inherent conflict between maintaining institutional security and upholding the ethical obligation to report potential misconduct. Correctional officers in the Federal Bureau of Prisons BOP are entrusted with significant authority and responsibility, requiring a high degree of integrity and adherence to established protocols. The dilemma arises from the personal relationship with the inmate, which could cloud judgment and create a temptation to overlook or downplay a violation. Careful judgment is required to ensure that personal feelings do not compromise professional duties and the integrity of the correctional system. The correct approach involves immediate and direct reporting of the observed infraction to the appropriate supervisory personnel. This aligns with BOP policy and federal regulations that mandate reporting of all inmate rule violations, regardless of the officer's personal feelings or perceived severity. The BOP Program Statement 5210. 11. Inmate discipline clearly outlines the procedures for reporting infractions and emphasizes the officer's duty to document and report any violation of the inmate code of conduct. This approach upholds the principle of accountability, ensures fair and consistent application of rules, and maintains the security and order of the institution. It prioritizes the safety and well-being of staff and inmates by addressing potential rule-breaking promptly. Failing to report the observed infraction, or attempting to handle it informally without supervisory notification, constitutes a significant ethical and regulatory failure. This approach undermines the established disciplinary process and creates a precedent for selective enforcement of rules, which can lead to a breakdown in institutional order and security. It also violates the officer's duty to accurately document inmate behavior, potentially shielding the inmate from consequences and creating a false record. Furthermore, it erodes trust among colleagues and supervisors, as it suggests a lack of commitment to professional standards. Another incorrect approach involves confronting the inmate directly and attempting to dissuade them from future rule-breaking without formal reporting. While seemingly an attempt to resolve the issue, this bypasses the established disciplinary procedures and lacks the necessary documentation and oversight. It places the officer in a position of informal adjudication, which is outside their designated role and can lead to unintended consequences or accusations of favoritism. The professional reasoning process for similar situations should involve a clear understanding of BOP policies and procedures regarding inmate discipline and reporting. When an infraction is observed, the officer must first identify the specific rule violated. Then, they must consult relevant BOP program statements and regulations to determine the appropriate course of action. The primary consideration should always be the adherence to established protocols for reporting and documentation, irrespective of personal relationships or perceived minor nature of the violation. If there is any doubt about the proper procedure, seeking guidance from a supervisor is paramount. This systematic approach ensures that all actions are consistent with legal requirements and ethical obligations, thereby safeguarding institutional integrity and promoting a safe environment. Question 4. Quality control measures reveal that a correctional officer in a Federal Bureau of Prisons facility in Texas observes an inmate exhibiting unusual lethargy and complaining of severe abdominal pain, but the inmate is also known for frequently attempting to manipulate staff. What is the most appropriate immediate course of action for the correctional officer? Option A. Attempt to administer basic first aid and pain relief measures while observing the inmate. Option B. Advise the inmate to rest and monitor their condition, as they may be seeking attention. Option C. Immediately notify the health services unit and secure the inmate's location pending medical assessment. Option D. Wait to report the situation until the inmate's symptoms become more severe or a supervisor is available. The correct answer is C. Immediately notify the health services unit and secure the inmate's location pending medical assessment. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a correctional officer in a Federal Bureau of Prisons (BOP) facility to balance the immediate need for security with the potential for an inmate to be experiencing a genuine medical emergency. Misinterpreting the situation could lead to delayed critical care for an inmate or an unnecessary diversion of resources, potentially compromising the safety of staff and other inmates. The officer must make a rapid assessment based on limited information and observable behaviors, adhering to BOP policy and ethical obligations. Correct approach analysis. The best professional practice involves immediately initiating the established emergency medical protocol for the facility. This means alerting the appropriate medical personnel, e.g., health services unit staff, and securing the area to prevent further harm or interference. This approach is correct because BOP policy mandates that all inmate medical concerns, regardless of perceived severity or the inmate's demeanor, must be promptly reported and assessed by qualified medical staff. The priority is always the inmate's well-being and ensuring access to necessary medical care, while simultaneously maintaining institutional security. This aligns with the BOP's overarching mission to provide for the health and welfare of inmates within a secure environment. Incorrect approaches analysis. One incorrect approach is to dismiss the inmate's complaints as attention-seeking behavior without any further investigation or reporting. This fails to acknowledge the possibility of a serious underlying medical condition and violates the ethical duty to provide care. It also contravenes BOP policy that requires reporting all inmate medical issues. Another incorrect approach is to attempt to diagnose or treat the inmate's condition personally. Correctional officers are not medical professionals, and attempting to provide medical care beyond basic first aid is outside their scope of practice and can lead to harm. This also bypasses the established chain of command for medical emergencies and the expertise of the health services unit. A third incorrect approach is to delay reporting the situation until a supervisor is available or until the inmate's condition appears to worsen significantly. This delay can have critical consequences for the inmate's health and could be considered a dereliction of duty, as immediate reporting is crucial in potential medical emergencies. It also fails to adhere to the urgency required by BOP emergency medical procedures. Professional reasoning. Correctional officers should employ a systematic approach to inmate medical concerns. This involves 1. Observation, carefully observing the inmate's behavior, vital signs, if apparent, and reported symptoms. 2. Reporting, immediately reporting any observed symptoms or inmate complaints of illness or injury to the health services unit or designated medical personnel, following facility protocols. 3. Securing, ensuring the safety of the inmate and the surrounding area while awaiting medical assessment. 4. Documentation, accurately documenting all observations and actions taken. The primary guiding principle is to err on the side of caution and ensure that all potential medical issues are addressed by qualified medical professionals in a timely manner, consistent with BOP policy and the inmate's right to medical care. Question 5. Quality control measures reveal that a correctional officer in a Federal Bureau of Prisons facility in Texas observes an inmate exhibiting increasingly erratic behavior, including pacing, muttering to himself, and making unusual gestures. The inmate has no prior documented history of mental health issues, but his current presentation is concerning. What is the most appropriate immediate course of action for the correctional officer? Option A. Document the behavior in the inmate's logbook and continue with routine duties, assuming the inmate is attempting to gain attention. Option B. Observe the inmate closely for further behavioral changes, discreetly notify the unit manager and or mental health services of the observations, and prepare to follow their guidance. Option C. Immediately place the inmate in restraints and move him to the segregation unit for observation and disciplinary review. Option D. Approach the inmate directly and attempt to engage him in a casual conversation to ascertain the cause of his behavior, offering advice as needed. The correct answer is B. Observe the inmate closely for further behavioral changes, discreetly notify the unit manager and or mental health services of the observations, and prepare to follow their guidance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a correctional officer in a Federal Bureau of Prisons, BOP, facility to balance the immediate need for security and order with the potential for an inmate's underlying mental health crisis to escalate. Misjudging the situation could lead to unnecessary use of force, a worsening of the inmate's condition, or a security breach. The officer must rely on established protocols and observational skills to make a sound judgment under pressure. Correct approach analysis. The best professional practice involves a multifaceted approach that prioritizes de-escalation and professional intervention. This begins with observing the inmate's behavior for specific indicators of distress or potential threat, such as agitation, verbal threats, or self-harm ideation. Simultaneously, the the officer should discreetly alert the appropriate BOP mental health professionals or the unit manager, providing a clear and concise report of observations. This approach is correct because it aligns with BOP policy directives on inmate management and mental health, which emphasize early identification of mental health issues and the utilization of specialized staff for assessment and treatment. It also adheres to the ethical obligation to treat inmates with dignity and respect while maintaining institutional safety. Incorrect approaches analysis. One incorrect approach involves immediately resorting to physical restraint or disciplinary action without attempting to assess the inmate's mental state or seeking specialized assistance. This fails to recognize the potential for a mental health crisis and could be seen as a punitive rather than a supportive response, potentially exacerbating the inmate's distress and violating BOP guidelines that encourage de-escalation and mental health support. Another incorrect approach is to ignore the inmate's behavior, assuming it is a minor issue or an attempt to manipulate staff. This neglects the officer's duty to observe and report potential risks to inmate well-being and institutional security. Such an action could lead to a serious incident if the inmate's condition deteriorates, and it bypasses the established BOP procedures for addressing inmate behavioral concerns. A third incorrect approach is to engage in prolonged, informal counseling or advice giving without involving trained mental health professionals. While empathy is important, correctional officers are not trained mental health counselors. This approach risks misinterpreting the situation, offering inappropriate advice, and delaying necessary professional intervention, which could have negative consequences for the inmate and the institution. Professional reasoning. Correctional officers should employ a systematic decision-making process that begins with observation and information gathering. This involves recognizing behavioral cues, understanding the potential underlying causes, including mental health issues, and knowing when to escalate the situation to appropriate personnel. The BOP's Standard Operating Procedures, SOP, and Program Statement on Mental Health Services provide the framework for this process, emphasizing a collaborative approach between security staff and mental health professionals to ensure the safety and well-being of all individuals within the facility. Question 6. Governance review demonstrates that a correctional officer in a Federal Bureau of Prisons facility in Texas observes an inmate in their cell exhibiting signs of significant distress, stating, "I can't take it anymore. I'm going to end it all tonight." What is the most appropriate immediate course of action for the correctional officer to take? Option A. Immediately secure the inmate to prevent self-harm, alert medical staff and supervisory personnel, and maintain observation while communicating with the inmate. Option B. Attempt to physically restrain the inmate and force them to calm down before calling for assistance. Option C. Engage in an extended conversation with the inmate to understand their problems and offer personal advice. Option D. Advise the inmate that such statements are not tolerated and continue with routine cell block rounds. The correct answer is A. Immediately secure the inmate to prevent self-harm, alert medical staff and supervisory personnel, and maintain observation while communicating with the inmate. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a correctional officer in a Federal Bureau of Prisons BOP facility to balance the immediate need for security and order with the ethical obligation to ensure inmate well-being and adherence to established protocols. The officer must make a rapid assessment of a potentially volatile situation, considering the inmate's stated intent, the potential for escalation, and the BOP's mandate for safe and humane confinement. Failure to properly assess and respond can lead to inmate harm, security breaches, or disciplinary action against the officer. Correct approach analysis. The best professional practice involves immediately initiating the established BOP protocol for inmate medical emergencies and potential self-harm. This means securing the inmate to prevent immediate harm, alerting medical staff and supervisory personnel without delay, and maintaining a safe distance while observing and communicating with the inmate. This approach is correct because it prioritizes inmate safety, adheres to BOP Program Statement 5210.05, Inmate Medical and Mental Health Care, which mandates prompt medical attention and crisis intervention, and upholds the officer's duty to report and manage potential emergencies according to established procedures. It ensures that trained medical professionals are involved and that the situation is managed within the secure confines of the institution. Incorrect approaches analysis. One incorrect approach is to dismiss the inmate's statement as attention-seeking and continue with routine duties without further investigation or reporting. This fails to acknowledge the potential severity of the inmate's distress and violates the BOP's responsibility to address inmate well-being. It could lead to a tragic outcome if the inmate's statement was genuine and they subsequently harmed themselves. Another incorrect approach is to attempt to physically restrain or coerce the inmate into compliance without first involving medical or supervisory staff. This could escalate the situation, potentially leading to injury to both the inmate and the officer, and bypasses the proper channels for managing a mental health crisis or medical emergency as outlined in BOP policy. It also risks violating the inmate's rights and could result in a formal complaint. A third incorrect approach is to engage in prolonged, informal counseling with the inmate without involving appropriate medical or mental health professionals. While empathy is important, correctional officers are not trained mental health counselors. This approach delays necessary professional intervention and could inadvertently provide inappropriate advice or create a false sense of security for the inmate, while the underlying issue remains unaddressed by qualified personnel. Professional reasoning. Correctional officers should employ a structured decision-making process that begins with immediate threat assessment. When faced with a statement indicating potential self-harm or medical distress, the primary steps are to ensure immediate safety, activate emergency protocols, and notify appropriate specialized personnel, medical, mental health, supervisory. Documentation of all observations and actions is crucial. This systematic approach ensures that institutional policies are followed, inmate welfare is prioritized, and the officer acts within their scope of authority and training. Question 7. Quality control measures reveal that an inmate in a Federal Bureau of Prisons facility in Texas is exhibiting erratic behavior, including shouting incoherently and appearing disoriented, while pacing aggressively in their cell. The inmate has a known history of mental health challenges. What is the most appropriate immediate course of action for the correctional officer on duty? Option A. Immediately notify the health services unit and the shift supervisor, while maintaining visual observation and ensuring the cell remains secure. Option B. Assume the inmate is attempting to manipulate staff and ignore the behavior until it escalates further. Option C. Attempt to verbally de-escalate the situation by entering the cell and speaking directly to the inmate without backup. Option D. Wait for the inmate's behavior to subside naturally before reporting it to any superiors or medical personnel. The correct answer is A. Immediately notify the health services unit and the shift supervisor, while maintaining visual observation and ensuring the cell remains secure. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a correctional officer to balance the immediate need for security and order with the potential for an inmate to be experiencing a genuine medical or mental health crisis. Misinterpreting the situation could lead to either a failure to provide necessary care, potentially resulting in harm or death, or an unnecessary escalation that compromises safety and resources. The officer must make a rapid assessment under pressure, considering limited information and the inherent risks within a correctional environment. Correct approach analysis. The best professional practice involves prioritizing the inmate's immediate well-being while adhering to established protocols for medical emergencies. This approach involves immediately notifying medical staff and supervisors, as per Federal Bureau of Prisons, BOP, policy regarding inmate health and safety, and maintaining a secure perimeter to prevent further harm or escape while awaiting professional medical assessment. This ensures that the inmate receives appropriate care without compromising the safety and security of the institution. BOP policy mandates prompt reporting of any inmate exhibiting signs of distress or potential medical issues to the health services unit. Incorrect approaches analysis. One incorrect approach is to dismiss the inmate's behavior as attention-seeking or manipulative without any attempt at verification. This fails to meet the ethical obligation to ensure the health and safety of all inmates and violates BOP guidelines that require all reported health concerns to be investigated. Risks overlooking a genuine medical emergency. Another incorrect approach is to immediately use force to subdue the inmate without assessing the underlying cause of their distress. This escalates the situation unnecessarily and could cause harm to an inmate who may be experiencing a medical crisis, such as a seizure or a severe panic attack. BOP policy emphasizes de-escalation and appropriate use of force only when necessary for safety and security. A further incorrect approach is to delay reporting the incident to medical staff and supervisors while attempting to manage the situation independently. This bypasses the established chain of command and deprives medical professionals of timely information, potentially delaying critical treatment and violating BOP protocols for incident reporting and medical emergencies. Professional reasoning. Professionals should employ a systematic approach to inmate welfare and security. This involves 1. Observe and assess. Note the inmate's behavior and any observable symptoms. 2. Report immediately. Follow established protocols for reporting any signs of distress to the appropriate personnel, medical staff, supervisors. 3. Secure and contain. Ensure the safety of the inmate and others while awaiting professional intervention. 4. Follow orders. Cooperate with medical and supervisory personnel once they are engaged. This framework prioritizes inmate well-being and institutional security through adherence to policy and professional judgment. Question 8. Quality control measures reveal a correctional officer at a federal penitentiary in Texas has received an inmate request concerning a potential security breach within the facility. The inmate claims to have overheard a conversation that could indicate a plan for contraband smuggling. The officer is unsure of the inmate's motives and the veracity of the information. What is the most appropriate immediate course of action for the correctional officer to take? Adhering strictly to Bureau of Prisons BOP guidelines. Option A. Dismiss the inmate's claim as likely fabricated and ignore the request to avoid unnecessary administrative work. Option B. Document the inmate's statement thoroughly and immediately refer the information to the unit manager or designated security supervisor for further investigation and action. Option C. Attempt to question the inmate further to gather more details about the overheard conversation without involving any supervisors. Option D. Promise the inmate that their information will be acted upon immediately and that the situation will be resolved swiftly. The correct answer is B. Document the inmate's statement thoroughly and immediately refer the information to the unit manager or designated security supervisor for further investigation and action. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a correctional officer to balance the immediate need for information with the strict protocols designed to maintain institutional safety and inmate rights. The officer must assess the credibility of the information, the potential risks associated with the inmate's request, and the BOP's established procedures for handling sensitive information and inmate requests. Failure to adhere to proper protocol could compromise security, violate inmate privacy, or lead to the dissemination of misinformation. Correct approach analysis. The best professional practice involves a systematic and protocol-driven approach. This means acknowledging the inmate's request, documenting it accurately, and then referring it to the appropriate channels for review and action, such as the unit manager or designated staff responsible for inmate grievances or requests. This approach ensures that the request is handled within the established framework of the Bureau of Prisons regulations, which prioritize security, due process, and the orderly management of the institution. By following established procedures, the officer avoids making unilateral decisions that could have unintended consequences and ensures that the inmate's request is addressed by those with the authority and expertise to do so. This aligns with BOP Program Statement 5320. 11. Inmate correspondence, which outlines procedures for inmate communications and requests, emphasizing that all such matters must be processed through official channels. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the inmate's request without proper documentation or referral. This failure to follow established procedures can be seen as a dereliction of duty, as it bypasses the system designed to address inmate concerns and potentially overlook legitimate security issues or inmate rights violations. It also fails to create a record of the inmate's communication, which is crucial for accountability and tracking. Another incorrect approach is to attempt to investigate the inmate's claims independently without authorization or adherence to BOP policy. This could lead to the officer overstepping their authority, potentially compromising an ongoing investigation, or violating inmate privacy rights by gathering information through unauthorized means. Such actions could also create a security risk if the inmate is attempting to manipulate the officer. A third incorrect approach is to promise the inmate immediate action or a specific outcome without consulting the proper authorities. This sets unrealistic expectations and can lead to a breach of trust if the promise cannot be fulfilled. It also bypasses the necessary review process, which is in place to ensure that decisions are made based on policy and the overall security of the institution. Professional reasoning. Correctional officers must operate within a strict regulatory framework. When faced with an inmate request that touches upon sensitive information or potential security concerns, the professional decision-making process involves 1. Active listening and acknowledgement of the inmate's communication. 2. Accurate and thorough documentation of the request. 3. Immediate referral to the appropriate supervisor or designated staff according to BOP policy. 4. Avoiding personal judgment or independent action on matters outside one's direct purview or authorization. This ensures that all actions are compliant, secure, and ethically sound, upholding the integrity of the correctional system. Question 9. The evaluation methodology shows that a correctional officer in a United States Bureau of Prisons (BOP) facility observes an inmate exhibiting unusual restlessness and repeatedly glancing towards a specific area of the recreation yard, while also receiving a whispered, unverified tip from another inmate about potential contraband being passed. Considering the need for a comprehensive risk assessment, which of the following actions best represents the appropriate professional response? Option A. Directly and calmly interview the inmate about their behavior and concerns, observe their demeanor, and cross-reference any suspicions with the inmate's disciplinary record and available intelligence reports before taking further action. Option B. Confront the inmate aggressively about the tip and their behavior to elicit a confession or immediate compliance. Option C. Immediately place the inmate in segregation based on the unverified tip and their unusual behavior, pending a full investigation. Option D. Dismiss the inmate's behavior as normal inmate anxiety and take no immediate action, assuming the tip is unsubstantiated. The correct answer is A. Directly and calmly interview the inmate about their behavior and concerns, observe their demeanor, and cross-reference any suspicions with the inmate's disciplinary record and available intelligence reports before taking further action. Explanation. The evaluation methodology shows that a correctional officer in a United States Bureau of Prisons (BOP) facility faces a complex scenario involving a potential inmate risk. The professional challenge lies in accurately assessing the inmate's immediate threat level while adhering to strict BOP policies and maintaining institutional safety and security. Misjudgment can lead to serious consequences, including inmate or staff injury, escape, or contraband introduction. The officer must balance the need for intervention with the inmate's rights and the principles of due process. The best approach involves a systematic, multifaceted risk assessment that prioritizes immediate safety and corroborates observed behaviors with available intelligence. This includes conducting a direct, calm, and professional interview with the inmate to gather information, observing the inmate's demeanor and physical presentation for signs of distress or aggression, and cross-referencing any concerns with the inmate's known history, disciplinary record, and any relevant intelligence reports from BOP databases. This method is correct because it aligns with BOP Program Statement 5326-08, Inmate Discipline and Sanctions, which mandates a thorough and objective investigation of alleged rule violations and emphasizes the importance of gathering all relevant facts before taking disciplinary action or implementing security measures. It also reflects the BOP's overarching commitment to maintaining a safe and secure environment through proactive risk management and adherence to established protocols. An incorrect approach would be to rely solely on a single piece of information, such as a rumor from another inmate, without independent verification. This fails to meet the BOP's requirement for objective evidence and can lead to unfounded disciplinary actions or unnecessary security interventions, potentially violating an inmate's rights and creating a hostile environment. Another incorrect approach is to make a snap judgment based on the inmate's appearance or a perceived attitude without engaging in a proper assessment process. This is subjective, unprofessional, and contrary to the principles of fairness and due process outlined in BOP policy. Finally, ignoring the inmate's behavior and assuming no risk because there are no overt signs of immediate danger, despite other indicators, is also a failure. This neglects the proactive risk assessment mandate and could allow a developing threat to escalate. Professional reasoning in such situations requires a structured decision-making process. Officers should first identify the observable fact and potential risks. Then they must consult relevant BOP policies and procedures to guide their actions. Next, they should gather and corroborate information from multiple sources, including direct observation, inmate statements, and official records. Finally, they must document their assessment and the actions taken, ensuring transparency and accountability. Question 10. Quality control measures reveal a group of inmates in a Federal Bureau of Prisons facility in Texas are expressing dissatisfaction regarding the perceived unequal distribution of recreational equipment during scheduled yard time. An inmate representative approaches you, the correctional officer on duty, stating that their unit is consistently receiving fewer basketballs and volleyballs than other units, impacting their morale and leading to potential unrest. You are tasked with assessing the situation and determining the most appropriate initial response to mitigate risk. Calculate the potential difference in the number of available basketballs per inmate if the stated grievance were true, assuming Unit A has 15 inmates and receives 3 basketballs, while Unit B has 20 inmates and receives 5 basketballs, and the total number of basketballs available for distribution across both units is 8. Option A. The difference in basketballs per inmate is 0. 10. Calculated by dividing the total number of basketballs by the total number of inmates and comparing this average to the ratio in Unit A. Option B. The difference in basketballs per inmate is 0. 20. Calculated by subtracting the number of basketballs in Unit A from Unit B and dividing by the total number of inmates. Option C. The difference in basketballs per inmate is 0. 15. Calculated by finding the difference in the number of basketballs received by each unit and dividing by the number of inmates in Unit A. Option D. The difference in basketballs per inmate is approximately 0. 0.5. Calculated by finding the ratio of basketballs per inmate for each unit and subtracting the smaller from the larger. The correct answer is D. The difference in basketballs per inmate is approximately 0. 0.5. Calculated by finding the ratio of basketballs per inmate for each unit and subtracting the smaller from the larger. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a correctional officer in a Federal Bureau of Prisons (BOP) facility in Texas to balance the immediate need for security and order with the potential for inmate unrest stemming from a perceived inequity in resource allocation. The officer must make a rapid assessment of the situation, considering the potential for escalation, while adhering to BOP policies and procedures regarding inmate grievances and resource management. Failure to act appropriately could lead to a breakdown in order, safety concerns for staff and inmates, and potential legal repercussions for the BOP. Correct approach analysis. The best professional practice involves a systematic approach to risk assessment and de-escalation. This begins with a direct, calm, and professional engagement with the inmate representative to understand the specific nature of the grievance. The officer should then gather objective data to verify the claim, such as inmate counts, distribution logs, and facility schedules. Based on this verified information, the officer should explain the BOP's established procedures for resource allocation and grievance resolution, offering a clear timeline for review or resolution if the grievance is found to have merit. This approach is correct because it directly addresses the inmate's concerns through established channels, promotes transparency, and adheres to BOP policy on inmate rights and grievance procedures, thereby mitigating the risk of unrest through communication and adherence to protocol. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the inmate's concerns without investigation, citing general security protocols. This fails to acknowledge the inmate's right to voice grievances and can foster resentment and distrust, increasing the likelihood of unrest. It violates the ethical principle of fairness and the BOP's commitment to a structured grievance process. Another incorrect approach is to promise immediate, unverified concessions or to deviate from established resource allocation policies to placate the inmates. This undermines the integrity of BOP procedure, sets a dangerous precedent for future demands, and could create new security risks by misallocating resources. It is ethically unsound as it prioritizes short-term appeasement over long-term order and fairness. A third incorrect approach is to escalate the situation by immediately calling for a lockdown or using excessive force without a clear and present danger. This is an overreaction that can be disproportionate to the perceived threat and can create a hostile environment, potentially leading to the very unrest the officer is trying to prevent. It violates the BOP's use of force policy, which mandates proportionality and de-escalation. Professional reasoning. Professionals in this situation should employ a tiered decision-making framework. First, assess the immediate threat level. Second, engage in active listening and information gathering to understand the root cause of the grievance. Third, consult relevant BOP policies and procedures to determine the appropriate course of action. Fourth, communicate clearly and transparently with the inmates, explaining the process and expected outcomes. Finally, document all actions taken and communications made. This systematic approach ensures that decisions are informed, ethical, and aligned with the BOP's mission and regulations. Question 11. Compliance review shows a correctional officer in a Federal Bureau of Prisons facility observes an inmate exhibiting agitated behavior, pacing erratically, and muttering incoherently. The officer suspects the inmate may be experiencing a mental health crisis. What is the most appropriate immediate course of action for the officer to take? Option A. Ensure the inmate is not an immediate threat to themselves or others. Then immediately notify both the unit supervisor and the health services unit. Option B. Immediately place the inmate in disciplinary segregation to de-escalate the situation and prevent disruption. Option C. Continue with routine patrol duties and document the inmate's behavior for a later report without immediate intervention. Option D. Engage in a lengthy conversation with the inmate to try and calm them down and understand their issues. Correct answer is A. Ensure the inmate is not an immediate threat to themselves or others, then immediately notify both the unit supervisor and the health services unit. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a correctional officer to balance the immediate need for security and order with the potential for an inmate's mental health crisis to escalate. Misjudging the situation could lead to either a security breach or a failure to provide necessary care, both of which have serious consequences. The officer must act decisively, but also with an understanding of the inmate's potential vulnerability. Correct approach analysis. The best professional approach involves prioritizing the inmate's immediate safety and well-being, while simultaneously initiating established security protocols. This means ensuring the inmate is not a danger to themselves or others, and then promptly notifying the appropriate medical and supervisory personnel. This approach aligns with the Federal Bureau of Prisons (BOP) Program Statement 5326-07, Inmate Mental Health Care, which mandates that staff observe and report any signs of mental distress and ensure inmates receive timely access to mental health services. It also adheres to BOP Program Statement 1000-06, Inmate Discipline, which requires officers to manage inmate behavior in a manner that ensures safety and security, but not at the expense of an inmate's health needs when those needs are apparent. This approach ensures that the inmate receives the necessary attention for their mental state while maintaining institutional control. Incorrect approaches analysis. One incorrect approach is to immediately place the inmate in segregation without further assessment or notification of medical staff. This fails to recognize the potential mental health component of the inmate's behavior and could exacerbate their distress, potentially violating BOP Program Statement 5326-07 by delaying appropriate mental health intervention. It prioritizes a punitive or containment response over a therapeutic one when the latter may be indicated. Another incorrect approach is to ignore the inmate's behavior, assuming it is a disciplinary issue, and proceed with routine duties. This is a critical failure to observe and report potential signs of mental distress as required by BOP Program Statement 5326-07. It risks the inmate's well-being and could lead to a more severe incident, including self-harm or harm to others, due to untreated mental health issues. A third incorrect approach is to attempt to counsel the inmate extensively on their own without involving medical or supervisory personnel. While empathy is important, correctional officers are not trained mental health professionals. This approach bypasses the established chain of command and the expertise of medical staff, potentially offering inappropriate advice or failing to recognize the severity of the inmate's condition, thus violating the spirit and letter of BOP directives regarding mental health care and staff responsibilities. Professional reasoning. Correctional officers must employ a layered decision-making process. First, assess the immediate threat to safety and security. Second, observe and document any indicators of distress, including mental health concerns. Third, follow established protocols for reporting and intervention, which in this case means notifying both medical and supervisory staff. This ensures that the inmate's needs are addressed by the appropriate professionals while maintaining institutional order and security. The officer's role is to be the first line of observation and reporting, initiating the correct response pathway. Question 12. The audit findings indicate a pattern of inconsistent application of inmate behavioral assessment protocols within a Federal Bureau of Prisons facility in the United States. A correctional officer observes an inmate exhibiting restless pacing and muttering to themselves in the common area. The inmate has a history of minor disciplinary infractions for insubordination, but no history of violence. Based on this observation, which of the following represents the most appropriate and professionally sound course of action for the correctional officer? Option A. Immediately place the inmate in administrative segregation due to their restless behavior and past disciplinary record as a precautionary measure. Option B. Rely solely on the inmate's past disciplinary record of insubordination to justify a formal disciplinary report and a period of observation in the special housing unit. Option C. Confront the inmate aggressively to assert authority and determine the cause of their agitation. Option D. Observe the inmate's behavior closely for any escalation or specific threats. Consult the inmate's file for any relevant behavioral notes or mental health concerns, and be prepared to intervene with de-escalation techniques if necessary. The correct answer is D. Observe the inmate's behavior closely for any escalation or specific threats. Consult the inmate's file for any relevant behavioral notes or mental health concerns, and be prepared to intervene with de-escalation techniques if necessary. Explanation. The scenario presents a challenge for a Federal Bureau of Prisons (BOP) correctional officer in the United States because it requires balancing the need for security and order within the correctional facility with the ethical and legal obligations to ensure inmate well-being and due process. Misjudging the risk associated with an inmate's behavior can lead to either an unnecessary escalation of force, potentially violating inmate rights and BOP policy, or a failure to adequately address a genuine security threat, jeopardizing staff and inmate safety. The officer must exercise sound judgment based on observable behavior and established protocols, rather than assumptions or personal biases. The best approach involves a systematic and objective assessment of the inmate's current behavior and immediate environment. This means observing the inmate for any signs of distress, agitation, or intent to harm themselves or others, and cross-referencing these observations with the inmate's known history and any relevant intelligence. This approach is correct because it aligns with BOP's core mission of maintaining a safe and secure environment while respecting inmate rights. Specifically, BOP Program Statement 5500-05, Inmate Discipline, emphasizes the importance of objective evidence and due process in disciplinary actions, and Program Statement 1310-03, Use of Force, mandates that force be used only when necessary and justified by the circumstances, with a preference for de-escalation. This methodical assessment ensures that any intervention is proportionate and legally defensible. An approach that relies solely on the inmate's past disciplinary record without considering current behavior is flawed. While past behavior can inform risk assessment, it does not automatically predict future actions. Focusing exclusively on the past can lead to preemptive disciplinary actions or excessive security measures that are not warranted by the present situation, potentially violating an inmate's right to be judged on current conduct. Another incorrect approach is to immediately involve the Special Housing Unit, SHU, based on a vague feeling or a minor infraction. This bypasses the established procedures for assessing and managing inmate behavior, which often involve progressive discipline and de-escalation techniques. Such an action could be considered an arbitrary deprivation of liberty and an improper use of restrictive housing, which is intended for inmates who pose a significant and immediate threat. Finally, an approach that involves confronting the inmate aggressively without a clear, objective reason or a plan for de-escalation is professionally unacceptable. This can escalate the situation unnecessarily, increase the risk of physical confrontation, and violate BOP policies on professional conduct and the use of force. It demonstrates a lack of control and judgment, potentially leading to an incident that could have been avoided. Professionals should employ a decision-making framework that prioritizes objective observation, adherence to established protocols, and de-escalation. This involves gathering information, assessing the immediate threat level, consulting relevant policies and procedures, and choosing the least restrictive but most effective course of action. When in doubt, seeking guidance from a supervisor is a critical step in ensuring proper procedure is followed and risks are managed effectively. Question 13. The monitoring system demonstrates a pattern of increased inmate-to-inmate conflict within a specific housing unit at a Federal Bureau of Prisons (BOP) facility in Texas. Which of the following actions represents the most appropriate initial response for correctional officers to manage this escalating situation? Option A. Immediately implement a unit-wide lockdown and conduct random searches of all inmate cells to deter further conflict and establish a stronger presence. Option B. Rely solely on the observations of the senior officer on duty to assess the severity of the situation and determine the most immediate course of action. Option C. Address each reported altercation as an isolated incident by issuing disciplinary citations to the involved inmates without investigating underlying patterns of behavior or potential external influences. Option D. Conduct a thorough review of recent incident reports. Observe inmate interactions for behavioral cues, consult with unit staff for contextual insights, and analyze any available intelligence to identify potential root causes before implementing targeted interventions. The correct answer is D. Conduct a thorough review of recent incident reports, observe inmate interactions for behavioral cues, consult with unit staff for contextual insights, and analyze any available intelligence to identify potential root causes before implementing targeted interventions. Explanation. The monitoring system demonstrates a pattern of increased inmate-to-inmate conflict within a specific housing unit at a Federal Bureau of Prisons (BOP) facility in Texas. This scenario is professionally challenging because it requires correctional officers to balance the immediate need for safety and security with the long-term goal of maintaining a controlled and rehabilitative environment. A failure to accurately assess and address the escalating tensions could lead to serious physical harm to inmates and staff, as well as significant disruptions to facility operations. The BOP's overarching mission, as outlined in its program statement 5320, 11 Inmate Discipline Program, emphasizes maintaining order, security, and the humane treatment of inmates. This situation demands a proactive and informed response, grounded in established BOP policies and professional judgment. The best approach involves a multifaceted risk assessment that prioritizes gathering comprehensive information before implementing interventions. This includes reviewing incident reports, observing inmate interaction, consulting with unit staff who have direct knowledge of the inmates involved, and considering any intelligence received from informants. The goal is to identify the root causes of the conflict, such as gang affiliations, personal disputes, or resource scarcity, and then to develop targeted interventions. These interventions could range from increased surveillance and targeted searches to inmate mediation or temporary separation of individuals deemed high risk. This approach aligns with BOP policy directives that advocate for evidence-based decision-making and the use of appropriate disciplinary and management tools to ensure institutional safety and security. An incorrect approach would be to immediately implement broad, punitive measures without a thorough understanding of the underlying issues. For instance, a blanket lockdown of the entire unit without specific intelligence might quell immediate disturbances, but could foster resentment and fail to address the core problems, potentially leading to future, more severe incidents. Another incorrect approach would be to rely solely on the observations of a single officer, especially if that officer has a pre-existing bias or limited exposure to the full context of the unit's dynamics. This could lead to misinterpretations and disproportionate responses. Furthermore, ignoring intelligence or reports that suggest a more complex underlying cause, such as gang-related activity, and instead treating each incident as an isolated event, would be a critical failure in risk assessment and could allow a dangerous situation to escalate unchecked. Professionals should employ a systematic decision-making process that begins with information gathering and analysis. This involves actively seeking out all relevant data, corroborating information from multiple sources, and critically evaluating its reliability. Based on this analysis, a determination of the level of risk should be made, followed by the selection of the most appropriate and least restrictive intervention strategy that aligns with BOP policies and promotes both security and inmate well-being. continuous monitoring and reevaluation of the situation are essential to ensure the effectiveness of interventions and to adapt to changing circumstances. Question 14. Cost-benefit analysis shows that proactive risk assessment is crucial for maintaining institutional safety within the Federal Bureau of Prisons. A correctional officer in a medium security facility in Texas observes an inmate exhibiting unusual quietness and avoiding eye contact with staff, behaviors that deviate from the inmate's typical outgoing demeanor. The officer also notes the inmate has recently been moved to a different housing unit and has had limited contact with known associates. Considering these observations, which of the following represents the most appropriate initial risk assessment approach? Option A. File a report detailing the observations but take no further action until a more significant security breach occurs. Option B. Immediately conduct a random, unannounced search of the inmate's cell and person based on the observed behavioral changes. Option C. Confront the inmate directly and demand an explanation for their changed behavior, potentially escalating the situation. Option D. Discreetly increase surveillance of the inmate, document all observed behaviors and interactions, and consult with the unit manager to assess the need for further investigation or intervention. Correct answer is D. Discreetly increase surveillance of the inmate, document all observed behaviors and interactions, and consult with the unit manager to assess the need for further investigation or intervention. Explanation. Scenario analysis. This scenario presents a professional challenge for a Federal Bureau of Prisons BOP correctional officer by requiring the assessment of potential inmate misconduct based on limited, albeit concerning, information. The officer must balance the need for security and order within the correctional facility against the rights and privacy of inmates, while also adhering to BOP policies and procedures. The difficulty lies in interpreting subtle cues and acting proactively without resorting to unfounded suspicion or overreach, which could lead to disciplinary issues for the inmate or the officer, or compromise institutional safety. Correct approach analysis. The best professional practice involves a systematic and documented approach to risk assessment that prioritizes observable behaviors and credible intelligence, aligning with BOP security directives and inmate management guidelines. This approach involves discrete observation, gathering information from reliable sources, e.g., inmate behavior patterns, known associates, contraband alerts, and consulting with supervisory staff before taking significant action. The justification for this approach is rooted in BOP's mandate to maintain a safe and secure environment, which requires officers to be vigilant and responsive to potential threats, but also to act ethically and within established protocols. This method ensures that interventions are based on evidence and are proportionate to the assessed risk, thereby minimizing the potential for false accusations or unnecessary disruptions. Incorrect approaches analysis. One incorrect approach involves immediate, punitive action based solely on a vague rumor or a single, ambiguous observation without further investigation. This fails to meet the standard of due process for inmates and can lead to unwarranted disciplinary actions, damaging morale and potentially creating grounds for grievance. Another incorrect approach is to ignore the potential risk entirely due to a lack of concrete proof, which neglects the officer's duty to proactively identify and mitigate security threats, potentially allowing a dangerous situation to develop. A third incorrect approach is to engage in intrusive, unauthorized searches or surveillance based on mere suspicion, violating inmate privacy rights and BOP policy regarding searches and investigations. Professional reasoning. Correctional officers should employ a structured decision-making process that begins with thorough observation and information gathering. When a potential risk is identified, the officer should document all observations and any intelligence received. This should be followed by consultation with a supervisor to determine the appropriate course of action, which may include increased surveillance, a formal interview, or a targeted search, all conducted in accordance with BOP policy and legal standards. This layered approach ensures that decisions are informed, justifiable, and aligned with the overarching goals of institutional security and inmate welfare. Question 15. The performance metrics show a consistent increase in inmate disciplinary infractions across several housing units at a federal correctional institution in Texas over the past quarter. What is the most effective initial step for a correctional officer to take in response to this trend? Option A. Propose a significant increase in disciplinary sanctions for all infractions, regardless of their nature or context. Option B. Conduct a detailed analysis of the disciplinary data to identify specific patterns, types of infractions, affected units and timeframes, and then collaborate with unit management and relevant staff to investigate potential contributing factors. Option C. Assume the increase is due to seasonal variations in inmate behavior and monitor the situation without immediate intervention. Option D. Immediately recommend a blanket increase in inmate lockdowns and restrictions across all affected units to deter further infractions. The correct answer is B. Conduct a detailed analysis of the disciplinary data to identify specific patterns, types of infractions, affected units and timeframes, and then collaborate with unit management and relevant staff to investigate potential contributing factors. Explanation: the performance metrics show a concerning trend in inmate disciplinary infractions within a federal correctional facility in Texas. This scenario is professionally challenging because it requires a correctional officer to interpret data, identify potential underlying causes, and propose actionable solutions that align with the Federal Bureau of Prisons (BOP) policies and the specific security and rehabilitation needs of the inmate population. A failure to accurately assess the situation and implement appropriate interventions could lead to increased institutional disorder, compromise safety for staff and inmates, and hinder rehabilitation efforts. The best approach involves a comprehensive review of the disciplinary data to identify patterns, and then correlating these patterns with observable inmate behaviors and environmental factors. This includes examining the types of infractions, the specific units or housing areas where they are occurring, and the timeframes. Following this, the officer should consult with unit management, case managers, and mental health professionals to gather qualitative insights and collaboratively develop targeted interventions. This approach is correct because it is data-driven, collaborative, and directly addresses potential root causes of increased infractions, aligning with BOP's emphasis on proactive management, inmate well-being, and maintaining a secure environment. It prioritizes understanding the why behind the numbers to implement effective solutions, rather than just reacting to the symptoms. An approach that focuses solely on increasing punitive measures, without understanding the underlying reasons for the infractions, is professionally unacceptable. It fails to address potential systemic issues such as inadequate programming, staff-to-inmate ratios, or unmet inmate needs, which can exacerbate tensions and lead to further disciplinary problems. It also neglects the rehabilitative aspect of corrections, which is a core component of the BOP mission. Another professionally unacceptable approach is to dismiss the performance metrics as insignificant or a temporary anomaly without further investigation. This demonstrates a lack of diligence and a failure to proactively manage institutional risks. Ignoring data trends can allow problems to escalate, potentially leading to more serious incidents and a decline in overall institutional safety and order. Finally, an approach that involves implementing broad, unresearched policy changes without consulting relevant staff or considering the impact on different inmate populations is also professionally unsound. Such actions can be arbitrary, ineffective, and may inadvertently create new problems or negatively affect inmate morale and rehabilitation progress. Professionals should employ a systematic decision-making process that begins with data analysis, followed by consultation with subject matter experts, the development of evidence-based interventions, and continuous monitoring and evaluation of their effectiveness. This iterative process ensures that responses are informed, appropriate, and aligned with the goals of the BOP. Question 16. During the evaluation of a common area in a federal correctional institution in Texas, a correctional officer observes two inmates engaged in a heated verbal exchange that is escalating in volume and intensity. Other inmates in the area are beginning to stop and watch the interaction. What is the most appropriate initial course of action for the correctional officer? Option A. Approach the inmates and ask them to explain what the problem is, making assumptions about their intentions based on their demeanor. Option B. Observe the interaction from a safe distance, assess the immediate threat level, and prepare to intervene verbally if the situation appears to be escalating towards physical violence while maintaining a visible presence. Option C. Ignore the interaction, assuming the inmates will resolve it themselves, and continue with routine patrols. Option D. Immediately approach the inmates with a firm voice and demand that they cease their argument, positioning oneself directly between them. The correct answer is B. Observe the interaction from a safe distance, assess the immediate threat level, and prepare to intervene verbally if the situation appears to be escalating towards physical violence, while maintaining a visible presence. Explanation: this scenario is professionally challenging because it requires a correctional officer to balance the immediate need for security and order with the ethical obligation to treat individuals with respect and dignity. Even when faced with potentially disruptive behavior, the officer must make a rapid assessment of a complex situation involving multiple inmates, a potential safety concern, and the need to maintain control within the facility. Careful judgment is required to de-escalate the situation effectively while adhering to Bureau of Prisons (BOP) policies and procedures. The best approach involves a calm, measured, and observant response that prioritizes de-escalation and information gathering. This entails observing the interaction from a safe distance, assessing the level of threat, and preparing to intervene only if necessary, while simultaneously communicating with the inmates in a non-confrontational manner. This strategy aligns with BOP guidelines that emphasize the use of the least restrictive means necessary to manage inmate behavior and maintain institutional safety. It allows for a thorough understanding of the situation before direct intervention, minimizing the risk of unnecessary force or escalation. An incorrect approach would be to immediately confront the inmates aggressively without fully understanding the nature of their interaction. This could escalate the situation, potentially leading to physical altercations and injuries, and may violate BOP policies regarding the use of force and inmate management. Another incorrect approach would be to ignore the situation, assuming it will resolve itself. This is a failure of duty and could allow a minor issue to develop into a significant security breach or safety hazard, contravening the officer's responsibility to maintain order and security. Finally, an approach that involves making assumptions about the inmate's intentions without direct observation or communication is unprofessional and can lead to misjudgments and inappropriate responses. Professionals should employ a decision-making framework that begins with situational awareness and threat assessment. This involves observing, listening, and gathering information before acting. The next step is to consider the available tools and strategies for de-escalation, prioritizing communication and the least restrictive intervention. If intervention is necessary, it should be proportionate to the threat and in accordance with BOP policy. Continuous evaluation of the situation and adaptability are also crucial. Question 17. What factors determine the ongoing need for heightened security measures and direct intervention for an inmate within a Federal Bureau of Prisons facility in Texas, beyond their initial classification? Option A. Observable changes in inmate behavior, interactions with other inmates, and the overall institutional climate, in conjunction with adherence to BOP directives on inmate management. Option B. The absence of any formal disciplinary infractions within the past 6 months, indicating a stable disposition. Option C. The inmate's stated desire to participate in vocational programs, regardless of their current behavior. Option D. The inmate's initial risk assessment score, assuming it accurately reflects their long-term propensity for violence. The correct answer is A. Observable changes in inmate behavior, interactions with other inmates, and the overall institutional climate, in conjunction with adherence to BOP directives on inmate management. Explanation: this scenario is professionally challenging because it requires a correctional officer to balance security protocols with the potential need for immediate intervention based on evolving risk factors. The officer must make a rapid assessment without compromising the safety of staff or inmates. Careful judgment is required to avoid both overreaction and underreaction, which could have serious consequences. The best approach involves a continuous, dynamic assessment of inmate behavior and environmental cues, coupled with adherence to established BOP protocols for reporting and intervention. This approach is correct because it prioritizes the safety and security of the institution by proactively identifying and mitigating potential threats. The BOP's Program Statement 5215-08, Inmate Classification and Management, emphasizes the importance of ongoing risk assessment and the need for officers to be vigilant in observing inmate conduct and interactions. This approach aligns with the BOP's mandate to maintain a secure and orderly correctional environment by empowering officers to make informed decisions based on real-time information and established procedures. An incorrect approach would be to ignore subtle changes in inmate demeanor or group dynamics, assuming that the initial risk assessment remains valid indefinitely. This failure to adapt to new information directly contravenes the BOP's emphasis on continuous monitoring and could lead to unforeseen security breaches or violence. Another incorrect approach would be to overreact to minor behavioral deviations without considering the context or the inmate's overall history, potentially escalating a situation unnecessarily and straining institutional resources. This could also lead to a breakdown in trust and cooperation with the inmate population. Finally, an approach that relies solely on inmate self-reporting without independent officer observation is insufficient, as inmates may not accurately or honestly report their intentions or the intentions of others. Professionals should employ a decision-making framework that includes 1. Situational awareness, constantly observing inmate behavior, interactions, and the overall environment. 2. Information gathering, utilizing all available information, including direct observation, intelligence reports, and inmate communication. 3. Protocol adherence, following established BOP policies and procedures for risk assessment, reporting, and intervention. 4. Escalation, knowing when and how to escalate concerns to supervisors or specialized units. 5. De-escalation, employing communication and tactical strategies to reduce tension and prevent incidents. Question 18. The risk matrix shows an inmate has a moderate risk score for potential disciplinary infractions. As a correctional officer in a Federal Bureau of Prisons facility in Indiana, what is the most appropriate immediate course of action to manage this inmate's risk? Option A. Use the moderate risk score as justification to increase the inmate's workload and restrict their recreational privileges as a preemptive disciplinary measure. Option B. Conduct a brief, direct conversation with the inmate to understand their current state of mind and any potential stressors, while continuing to monitor their behavior closely for any changes. Option C. Immediately place the inmate in administrative segregation based solely on the moderate risk score indicated by the matrix. Option D. Ignore the risk matrix score, as it is merely a guideline, and rely entirely on your personal judgment and past interactions with the inmate. The correct answer is B. Conduct a brief, direct conversation with the inmate to understand their current state of mind and any potential stressors, while continuing to monitor their behavior closely for any changes. Explanation: this scenario is professionally challenging because it requires a correctional officer to balance the immediate need for security and order with the long-term goal of rehabilitation and the ethical imperative to treat individuals with dignity. The risk matrix, while a tool for assessment, is not a substitute for professional judgment and understanding of individual circumstances. A rigid adherence to the matrix without considering contextual factors can lead to missed opportunities for intervention or, conversely, unnecessary escalation. The best approach involves a nuanced assessment that integrates the risk matrix findings with direct observation, inmate behavior, and available intelligence. This approach recognizes that the matrix is a guide, not a definitive pronouncement. It prioritizes a comprehensive understanding of the inmate's situation, including their history, current demeanor, and potential triggers, to inform the most appropriate course of action. This aligns with the Federal Bureau of Prisons (BOP) overarching mission to provide a safe, secure, and humane environment for inmates and staff, and to facilitate their successful reintegration into society. Ethical considerations demand that officers avoid prejudgment and strive for fair and consistent application of policies, while also being responsive to individual needs and risks. An incorrect approach would be to solely rely on the risk matrix's numerical score to dictate immediate disciplinary action or segregation without further investigation. This fails to acknowledge that risk assessments are dynamic and can be influenced by a multitude of factors not captured by a simple score. It also risks alienating the inmate and undermining the rehabilitative process by treating them as a static risk rather than an individual with potential for change. Another incorrect approach is to dismiss the risk matrix entirely and rely solely on intuition or personal bias. While experience is valuable, ignoring a standardized assessment tool can lead to inconsistent decision-making and potentially overlook significant risks that the matrix is designed to identify. This can compromise institutional safety and the officer's ability to justify their actions based on established protocols. Finally, an incorrect approach would be to apply the risk matrix in a punitive manner, using it as justification for harsher treatment beyond what is necessary for security. This violates the principle of proportionality and can create an environment of distrust and resentment, hindering any potential for positive engagement or rehabilitation. Professionals should employ a decision-making framework that begins with understanding the purpose of the risk assessment tool. They should then gather all relevant information, including the matrix, direct observations, and any available intelligence. This information should be synthesized to form a holistic picture of the individual and the situation. Decisions should be made based on this comprehensive understanding, always prioritizing safety and security, while also considering the inmate's rights and the BOP's rehabilitative goals. Regular review and reevaluation of risk assessments are crucial. Question 19. During a routine housing unit check at a Federal Bureau of Prisons facility in Texas, a correctional officer observes an inmate exhibiting unusual agitation, repeatedly pacing in their cell, and making furtive glances towards the cell door and other inmates. The officer has no prior specific intelligence regarding this inmate posing an immediate threat. What is the most appropriate course of action for the correctional officer to take in assessing the potential risk presented by this inmate? Option A. Immediately place the inmate in administrative segregation based on the observed agitation and furtive glances, pending further investigation. Option B. Disregard the behavior as typical inmate restlessness, assuming it does not pose an immediate threat to institutional safety. Option C. Confront the inmate directly and demand an explanation for their behavior based on the officer's personal assessment of the situation. Option D. Document the observed behaviors in the inmate's record and immediately report the concerns through the appropriate chain of command for further review by classification staff. Correct answer is D. Document the observed behaviors in the inmate's record and immediately report the concerns through the appropriate chain of command for further review by classification staff. Explanation. Market research demonstrates that effective risk assessment is paramount for maintaining institutional safety and security within the Federal Bureau of Prisons (BOP). This scenario is professionally challenging because it requires correctional officers to balance the immediate need for information gathering with the imperative to uphold inmate rights and institutional protocols. Misjudging the level of risk or employing inappropriate methods can lead to security breaches, inmate unrest, or violations of BOP policy. The best approach involves a systematic and documented process that prioritizes objective observation and adherence to established procedures. This means carefully observing the inmate's behavior, demeanor, and interactions, and then cross-referencing these observations with known indicators of potential risk as outlined in BOP Program Statement 5326. 03. Inmate classification and management. Any concerns identified should be immediately and accurately documented in the inmate's record and communicated through the proper chain of command for further assessment and intervention by designated classification staff. This method ensures that decisions are based on evidence, are consistent with BOP policy, and allow for a multidisciplinary approach to risk management, thereby safeguarding both staff and inmates. An incorrect approach would be to rely solely on intuition or hearsay from other inmates. This is professionally unacceptable because it bypasses established protocols for risk assessment, lacks objective evidence, and can lead to biased or inaccurate judgments. Such an approach undermines the integrity of the classification system and can result in misallocation of resources or inappropriate interventions. Another incorrect approach is to immediately implement restrictive housing based on a single, unverified observation. This fails to follow the prescribed steps for risk assessment and can be punitive rather than preventative. BOP policy emphasizes a graduated response to identified risks. An immediate restrictive housing without proper documentation and review can violate inmate due process and institutional fairness. Finally, an incorrect approach is to ignore the observed behavior due to a perceived lack of immediate threat. This is professionally unacceptable as it represents a failure to proactively identify and mitigate potential risks. The BOP's risk assessment framework is designed to be forward-looking, and overlooking even seemingly minor indicators can have significant consequences for institutional safety. Professionals should employ a decision-making framework that begins with a thorough understanding of BOP policies and procedures related to inmate behavior and risk assessment. This involves continuous observation, objective documentation, and timely reporting through the established chain of command. When faced with ambiguous situations, seeking guidance from supervisors, and consulting relevant policy documents are crucial steps. The focus should always be on evidence-based decision-making and adherence to the principles of institutional security and inmate welfare. Question 20. Quality control measures reveal that the Federal Bureau of Prisons facility in Terre Haute, Indiana, is projected to exceed its overtime budget by 15% over the next fiscal quarter due to increased inmate population and mandatory post coverage. The facility's current staffing level is 92% of authorized positions. If the authorized overtime budget for the quarter is $500,000, and the projected overtime expenditure is calculated to be 115% of this amount, what is the projected deficit in the overtime budget for the quarter? Option A, $75,000. Option B, $60,000. Option C, $575,000. Option D, $50,000. The correct answer is A, $75,000. Explanation. This scenario presents a professional challenge due to the inherent tension between maintaining security and ensuring the humane treatment of inmates, particularly when resource allocation is constrained. A correctional officer must balance the immediate need for safety and order with the long-term implications of inmate well-being and rehabilitation, all within the strictures of Federal Bureau of Prisons (BOP) policy and the U.S. Constitution. The calculation of overtime hours and its impact on staffing levels directly affects the ability to provide essential services and maintain adequate supervision, making accurate risk assessment and resource management paramount. The best approach involves a systematic and data-driven assessment of staffing needs against projected overtime. This requires a thorough understanding of BOP directives regarding staffing ratios for various security levels and inmate populations, as well as an awareness of the potential risks associated with understaffing, such as increased inmate misconduct, security breaches, and compromised staff safety. By calculating the total projected overtime hours needed to cover essential posts and comparing this to the allocated overtime budget, a correctional facility can proactively identify potential shortfalls. This allows for informed decision-making regarding the need for additional permanent staff, the prioritization of overtime assignments, or the adjustment of inmate programs and activities to align with available resources. This approach is ethically sound as it prioritizes the safety and security of both staff and inmates by ensuring adequate supervision, and it is regulatory compliant by adhering to BOP staffing guidelines and fiscal responsibility. An approach that prioritizes filling all overtime slots without a clear assessment of necessity, simply to avoid immediate staffing gaps, is professionally flawed. This can lead to inefficient use of funds and potentially over-reliance on overtime, which can contribute to staff burnout and decreased vigilance, thereby increasing risk. It fails to critically evaluate whether the overtime is truly essential for maintaining security or if alternative solutions exist. Another incorrect approach is to reduce inmate programming and recreational activities solely to offset overtime costs without a comprehensive risk assessment. While resource management is important, a drastic reduction in these areas can lead to increased inmate idleness, frustration, and potential for unrest, thereby creating new security risks that may require more resources to manage in the long run. This approach neglects the rehabilitative aspects of incarceration and can negatively impact the overall institutional climate. Finally, an approach that relies on anecdotal evidence or the personal judgment of supervisors without consulting staffing data and BOP guidelines is also professionally unsound. This can lead to inconsistent staffing decisions, potential biases, and a failure to identify systemic issues related to overtime utilization and its impact on operational effectiveness and safety. The professional decision-making process in such situations should involve 1. Clearly defining the problem, identifying the gap between required staffing and available resources due to projected overtime. 2. Gathering relevant data, collecting information on inmate population, security levels, BOP staffing mandates, and overtime budgets. 3. Analyzing the data, calculating projected overtime needs and comparing them to budgetary constraints. 4. Identifying and evaluating options, considering various solutions, including hiring permanent staff, strategic overtime allocation, and program adjustments, while assessing the risks and benefits of each. 5. Making a decision, selecting the option that best balances security, safety, fiscal responsibility, and inmate well-being, in accordance with BOP policy. 6. Implementing and monitoring, putting the chosen solution into action and continuously evaluating its effectiveness.